Welcome to my channel. I hope you all are studying well. Today I'll be discussing some important terms, okay, in oral pathology, which is confusing a little bit. And while solving MCQs, we usually go wrong, and it's very easy, but we go wrong because of confusions only. So to avoid those confusions, I'll be telling you some important terms. First is sialorrhea. This means increased salivation, okay? Okay. Then next is atresia. This is absence of salivary gland ducts. Okay. Now a very frequently asked term, which is sialosis. This is non-inflammatory and non-neoplastic. Then sialadenitis. This is inflammatory disease of salivary gland. Okay. Now sialolithiasis. This is nothing but the salivary duct stones present in the salivary gland and its ducts. Okay. Now the sialogogues. This is the drugs which increases the salivation. Okay. Now one more term is asked, which is called as sialadenosis. This is nothing but the sialosis. Okay. These all terms are confusing. So how you will remember? Atresia is the absence. A terms, wherever it comes, it is absent. Okay. Sialorrhea is related to salivation. It is increased salivation. Sialosis is non-inflammatory or non-neoplastic. जहाँ पे भी ITIS आता है, that represents inflammation. Okay. And lithiasis related to stones. And sialogogues are the drugs. If you are known with this term and you have studied these terms, write all these terms in one place, so that whenever you get confused, you just read this. Okay, this will be easy for you to remember. This is also a tip that for exams, when you are preparing, if you get confused or confusion with any terms, you just write it in one paper and see to it. If you are getting any topic in which you are getting confused, so just let me know in the comment section. I will try to simplify it for you guys. Or any topic you want to discuss, please let me know. Any query also, if you have for related to any topic, you can ask me. Thanks for watching. Stay tuned with me for more such tips and tricks for NEET preparations. I hope you guys finding it easy. Thank you for watching. Bye bye.